Financial donations are so important, as you mentioned. Do you also need volunteers?
Volunteers are so crucial to our region, and we actually do a lot of work with volunteers. We operate a regional volunteer center. So what we do there is we match volunteers with opportunities, and we match opportunities with volunteers. So there could be a group like the Adirondack Young Professionals, for example, who are very active, and they might reach out to us and say, we're looking for an opportunity, and we would work toward finding an opportunity for them. And then there could be, for example, it could work the other way, and so an organization or a municipality, for that matter, might reach out to us and say, we're having a event or initiative that we need volunteers for. Mm-hmm. So could you help us recruit volunteers? So both directions. And we do a lot of this work, and it's really great work, and it's very rewarding. And volunteers are the unsung heroes in our region. And they just do a phenomenal job. And volunteerism is largely an American tradition. Some would say we invented it. I would argue that's true, although I'm sure people were helping people from the beginning of time. But volunteerism as we know it is really an American tradition that has really evolved throughout the history of our country, and we're really good at it. And people just come out of the woodwork sometimes to help out, and it's really rewarding. But again, the impact volunteers have on our region and in our region is underrated and underappreciated. It's a significant impact that volunteers make across the region.
And if people are interested, go to your website, call you, and get together and figure out how best they can volunteer.
Exactly. We'd welcome the opportunity.
As CEO, you wear many hats. One of the hats you wear is as the co-chair of the Health Equity Task Force, which was put together in northern New York, 7 counties, to oversee the distribution of the vaccine. And for quite a while, you were doing that. You were organizing clinics and reaching outlying areas of the county to try to reach as many people as possible. Now, as time has gone on, and we've seen that we're in the 3 counties about 60% with the vaccination rate. Are there efforts underway to still try to boost those numbers even higher to try to get more people their shots?
Oh, absolutely. Absolutely. We're still doing the work that we started doing. That work continues. We're still organizing pods and mobile clinics, and we were just talking about it this week about some new initiatives. Schools, we're working on getting clinics set up in
and we're
schools.
waiting to see
Correct.
Who will be able to get the shot.
Yes,
at what age.
Exactly, and we're going to continue to do that work. The Health Equity Task Force, which I've really enjoyed doing. I mean, it's been incredibly challenging and tedious work, but I've really enjoyed doing it. And the mission of that group is to really create an equitable pathway for the vaccine. So people from all different walks of life and all different circumstances have a fair chance at getting the vaccine. That's how it started. It's evolved over time. Yeah. But really interesting and fascinating work. One of the things we've shifted a little bit of our focus toward is what we call the 7 pillars of prevention, because with the resurgence of infection rates in our region, in addition to vaccines, which we're going to continue to promote and encourage, we also want to remind people that precautions are still very necessary. Masking, social distancing, hand washing, and all the things that people have become accustomed to doing over the past 18 plus months. It's important to remind people of those things, because again, we're we're increasing the vaccine rate across the region, but we're also seeing vaccinated people test positive and in some cases become sick. So again, a lot more mild than they would be if they
Right.
weren't vaccinated, and likely not to be hospitalized.
Right.
That's huge. But nonetheless, vaccinated people are testing positive more than anyone anticipated several months ago. And so along with, again, encouraging vaccines, we also want to encourage people to take the precautions that they've become accustomed to. Again, mask wearing, hand washing, social distancing, things of that nature.
Yep, and with the breakthrough cases, probably even more of a need or suggestion that people get the booster shots when they become available, Pfizer to start with, and then eventually Moderna and Johnson & Johnson. Will the task force help in the coordination and distribution of the booster shots to try to encourage people to get out and help
absolutely.
facilitate them getting those booster shots?
Absolutely. Absolutely. Right now our focus is really on getting people who have not been vaccinated at all.
Still trying to get their first shots.
And still encouraging that. And it's very confusing for people. I'm not going to judge people on for their choice to get vaccinated or not. I'm going to encourage them to do it. I'm going to hope they do it. I'm going to provide, and our task force is going to provide information that we hope will lead them to the decision to get vaccinated if they have not already been vaccinated. But there's many reasons, Tom, that people are choosing not to get vaccinated, and they're complicated reasons. And people are often confused or overwhelmed by the media coverage and the barrage of information that is contradictory and from day to day.
Sure.
And so it's important for us doing this work to understand that it's very complicated, and it's a decision that is a personal decision beyond mandates. That is, that's a whole different ball game. But we don't want to shame people. We don't want to be too strong-armed in our approach. What we are setting out to do is to provide good, clear, concise information so people can utilize that information to make that choice on their own. And it's my hope and our hope that that choice will be to get vaccinated.